I am an occupational therapist, but I work at the Children's Hospital of Philadelphia, and I'm a neonatal intensive care unit therapist. So when I think about special education or early childhood intervention, I'm thinking at birth. Babies who are born prematurely, or babies who have medical complexities, or babies who aren't developing the way that they should because of their situation in a hospital.
Wow.
My role as an occupational therapist is to really help them sort of go through their development as best as I could within the setting of a hospital. A lot of times people ask, like, what are you doing therapeutically when a baby is just a baby in an incubator, or a baby in a crib at a hospital? What are you doing? When you think about how babies develop and progress through life, they are engaging with their environment, they're engaging with their parents, they're engaging with toys, even very, very early on. But when you're in a hospital on a ventilator and you're sedated because your heart rate isn't doing what it's supposed to be, how is this baby supposed to learn skills, to learn how to use their eyes, to learn how to use their hands, if they're in this position where they're not able to? We're trying to help them manage their sensory systems. We're trying to help them figure out, like, how do my eyes and my hands work together if I want to reach for a toy? How do I engage with my parents? Like, if I can't see my parents in the eye, how am I going to feel that love and that bonding? And on the flip side, for parents, if your child is on a ventilator, are you going to feel comfortable being able to pick them up off the bed and hold them and, do the kangaroo care and really bonding with your baby as soon as you've had them? Probably not. So part of my role is to help families and parents feel comfortable with managing the lines that are sort of attached to their baby while still being able to kind of hold them. And research shows that one-on-one bonding time with parents in the NICU is so important. So families don't feel empowered to be able to do that. Are they going to? And if they don't, then what is the prognosis or the outcomes for this baby once they leave the hospital? When I talk about early intervention, my role comes at the birth of the child. So whether the child is born preterm, whether the child is born full term, we are responsible for really helping them develop their senses and learn how to process their environment and bond with their families and their parents. Research indicates that there is a lot of benefits to a baby and a parent bonding after birth. And if a parent isn't able to hold their child or isn't able to kind of take care of them immediately, that there is long-term impacts to that. So our role is to really help them, really help foster that relationship early on.